Hi, I'm Jen Kay, and I'm here today at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on ADHD and how this particular condition can be treated with natural remedies using a whole person approach. Today, I'd like to introduce you to Dr. Oskin. Dr. Oskin is one of the many doctors here at the Arizona Natural Health Center who treats ADHD. Dr. Oskin, welcome.
Hi.
How are you today?
Good, how are you?
Good, thanks so much. Thanks for being here.
Oh, thanks for having me.
You know, ADHD has become such a common buzzword, and what I'd really like to find out from you is what really is ADHD and what are some of the common symptoms?
Sure. ADHD is actually the most commonly diagnosed psychiatric condition in kids, affecting 3 to 5% of our children in the United States. Some of the most common symptoms include things like difficulty staying on task or finishing projects. These kids that are constantly losing things, they can't remember their homework or they're losing their keys every day. They can sometimes have temper outbursts and can include bossiness. Sometimes they can even have decreased self-esteem because if they can't focus long enough to finish math problems or their homework, it can sometimes affect their grades in school, which can then negatively affect their self-esteem when they then have the negative self-talk if they don't feel like they're living up to their full potential.
Sure, it becomes an inevitable snowball.
Some kids have a hyperactive type of ADHD, and those are the kind of kids who seem like they're always on the go or like they're driven by a motor. These are the kids that are running and climbing and sometimes in inappropriate situations like at the wedding or other situations where you would want the kid to be maybe well behaved, and even though we don't expect little children to be like adults, the kids that are constantly on the go and we can't calm them down, it can sometimes become problematic and worth treating.
You've just described certainly a lot of things. I sometimes have hard time finding my keys or focus or what have you. But how would someone actually know or be able to recognize if they do have ADHD?
Sure. Well, the thing is that it's diagnosed mostly by a clinical picture. There are no labs or imaging right now that are used in the diagnosis. But really what we're looking for as doctors is something that's so detrimental that it's actually affecting the child in more than 2 settings. So it's significantly impacting them at home. Perhaps they're not functioning well in school, or it's really significantly affecting their grades. And so that's really how it helps us come to the diagnosis, according to certain standardized criteria.
Okay. And so if I may ask, it sounds to me like maybe there's even certain ongoing patterns of behavior, not just sort of a one-time, outburst or challenge or one specific class, maybe in multiple areas. Is that right?
Yeah, exactly. These kids often will have, usually for the diagnosis, these kids will have problems that start before the age of 7.
Wow.
But often they're not found until they reach elementary school age, even if they showed tips of these types of problems when they're really young, because we really don't see them really having difficulty thriving and having success in school until they're in another situation outside of the home where we can pick up on those problems.
So once they're placed in maybe a little more structure, right? Because otherwise kids are just kids,
right,
it's to be running around playing. And so once they come into that environment, that's one of the reasons why you begin to notice it a little bit later. Is that right?
Right.
Okay. So tell me then, if once maybe you have an indication, of ADHD and maybe go so far as a diagnosis, you get that information. What are some of the treatments for it, really?
Sure. Well, in conventional medicine, traditionally, kids with ADHD are treated with 2 basic treatments. One is behavioral modification techniques. These are great. They're essentially tips we can give teachers and parents to help the child thrive at home and at school, giving them techniques to help them focus or to plan their day. The other main thing is that there are medications in conventional medicine like methylphenidate, which is the generic for Ritalin.
Oh, okay.
Basically, the drugs used for ADHD are stimulant medications. So for adults, you may be able to think about it like you're having a hard day focusing on your work and you take a little extra caffeine. It's a stimulant and it helps you focus. Well, for these kids, that's the same idea. Essentially, the thought is that the part of their brain that needs to focus can't focus well enough, and so we give them a stimulant medication to help them focus better. Some of the side effects of these medications include things like dry mouth, nausea. Some of the more serious things are things like weight loss, because kids on these medications sometimes don't want to eat, and then they can have weight loss, and if that goes on for a long time, they might have some growth difficulties. The other thing that can happen is just like taking too much caffeine. Being on a stimulant medication can cause kids to have insomnia, trouble sleeping, and in rare conditions, it can actually cause tics. So any kids with tic disorders like Tourette's, it's usually contraindicated for them to be on stimulant medications like methylphenidate.
Wow. You hear so many things today about some of the, drugs and pharmaceuticals that have such ongoing side effects. I can't even begin to imagine what that would be like at a young age to, have that in an ongoing manner. And yet, that's the more conventional approach, right?
Right.
You have a very different way of approaching that here at the Arizona Natural Health Center, don't you?
Yes, here at Arizona Natural Health Center, we approach treating ADHD with homeopathy. Homeopathy is a wonderful 200-year-old system of natural medicine that uses really safe, gentle, natural medicines with no known side effects to stimulate the child to self-heal. It's really amazing, and I love using homeopathy, especially with kids, because they react so well to homeopathy and they get better, and it really helps families, and it's just an amazing thing to see.
Your whole face lights up just talking about it. I'm like, wow, that's so cool. So when you see those results, would you be willing to share, a specific example of maybe a young patient that you've helped with homeopathy?
Yeah, recently I treated a boy who was 5 years old. He came in, and he's one of those typical kids that mom would call a holy terror.
Sure.
He's the child who was at 5 staying up till 1 o'clock in the morning every night. He was wetting the bed 4 nights a week, hitting and kicking his sisters. He couldn't focus in school, was constantly on the go, climbing, and wouldn't sit still. And it was really causing a problem both for mom but also for the child in school. Within about 1 month of homeopathic treatment, he was no longer wetting his bed. He was going to bed at a reasonable time. If he got in trouble, instead of breaking the chair in the timeout, he would actually go and sit and self-soothe to help himself calm down. And mom noticed a world of difference. And it's just so fun to work with kids and to watch them get better, because you know that when you're helping that child, you're helping the whole family, and it's just a really rewarding part of my job.
I can see that it is. So within 1 month of homeopathy, the child's behavior completely shifted. Mm-hmm. And I think, it's a big question that a lot of people have is, does this really work?
Mm-hmm. Yeah, there's actually 2 really good homeopathy studies for ADHD and homeopathy. The first was done in 2001, and it actually looked at homeopathy and compared to methylphenidate, which is the generic for Ritalin.
Okay.
What they found in the study was that 75% of the kids treated with homeopathy did better over the course of about 22 months, compared to 65% of the kids in the study did better on Ritalin. So actually very impressive results. One of the things they found is there were less side effects with the kids who were treated homeopathically. The other main difference is that homeopathy works by stimulating the child to self-heal. So instead of putting like a Band-Aid or just treating the symptoms with a medication, it actually sometimes is a little slower, longer process to completely resolve all the symptoms of the ADHD, because we have to actually change the child to be a healthier child overall, rather than just putting a Band-Aid on the situation.
And yet you take the time and the energy to really get to know each child as an individual and what those factors may be. Just like you treat the adults with homeopathy, you really strive to understand what's going to be the most appropriate remedy for that specific child, yes?
Right. So with conventional medicine, there are about maybe 4 or 5 typical ADHD drugs, and just about every child who gets one will get one of those drugs, and if they don't respond to one, they might try another drug. With homeopathy, it's a completely individualized therapy to each unique child. So we give a medicine that is very special and unique. Out of maybe, let's say, 200 different homeopathic medicines, we'll pick the one medicine that is unique for that individual child.
That's how soothing, and like I think you said it best. It was so inspiring for me when you soothe the child. When you heal the child, you heal the whole family.
Yeah.
So, I could sit here all day and ask you about more stories, because I know parents are so hungry for this information. They want to know how this can help their children. My biggest question though is this: so if someone I love and care about, or even in my ADHD moments, right? If I think that someone has that, is it just as simple as coming to see you or scheduling an appointment here at the Arizona Center for Natural Health?
Well, the most optimal thing is, yes, it would be great to schedule an appointment, come on in, and get individualized homeopathic treatment to help you or your child. The other thing is there are many tips that parents can do at home to get started with helping their kid on their own. For one, every growing child, for both their brain and their physical development, needs a diet full of whole foods, fresh fruits and fresh vegetables, and lots of essential fatty acids. There are lots of behavioral tips that parents and teachers can have. We put a list of them on our website, and I encourage you to go there to check out lots of these tips to help children focus and stay on tasks. Another thing parents can do with their kids is play games like the memory game or crossword puzzles or even picture puzzles. The reason is playing these games helps kids develop the neural networks to help with their focus and their memory and their attention span. And so simple games like that with your kids can actually have a really big impact. I would also suggest, for a lot of my parents, I recommend this book, Raising an Emotionally Intelligent Child by John Gottman. He's a PhD psychologist who did a lot of research with kids and families, and they found lots of effective parenting techniques, and parents try so hard, and they're all doing such a great job, and it's really difficult, and kids don't come with an instruction manual.
Right.
And it's even more difficult if you have a child who's maybe more challenging developmentally or behaviorally, and often parents will resolve to quick fixes when things get tough. And so I highly recommend a book like this, which can encourage you that you're doing the right things and maybe give you some tips for parenting in those difficult situations.
Dr. Oskin, that's so fascinating and fantastic to know that you've got those resources here available and on your website. Thank you so much.
Oh, thank you so much for your time.
Well, and thank you for sitting down and explaining ADHD and everything that's involved with it and how you all treat it here at the Arizona Natural Health Center. It's certainly been informational and helpful for me. I hope you found our segment today on natural remedies for common and not so common conditions especially helpful and informative. I strongly encourage you to watch the other videos in our series so that you can learn more about how natural remedies can benefit you in your life starting today. I'm Jen Kay, and on behalf of myself and the wonderful doctors here at the Arizona Center for Natural Health, thanks for watching. Have a fantastic day.